neuromuscular reeducation using some of these different protocols. So the first protocol that we're going to talk about is the Russian protocol. This was developed in the 1970s by Soviet athletes, or really by a doctor for Soviet athletes, to enhance muscle strength. And we use this to help re-educate certain muscles. We help it to promote strength of certain muscles. And some of the things that we'll notice here are, let's look at the waveform first of all. It's an alternating current, and this happens in a burst mode of 50 bursts per second. So we'll take a peek at that in the next slide. We have a little bit of a visual for you here. Each burst lasts about 10 milliseconds, which if you remember the phase duration for something like TENS, it's significantly shorter than that. So we're looking at, a high of 350 microseconds. Now each burst here in this Russian protocol is lasting 10 milliseconds, which is significantly longer. We're also going to use a carrier frequency of 2500 hertz. And just remember that the carrier frequency allows for greater penetration of the muscles. So we can stimulate deep muscles for strengthening. And just remember too that the carrier frequency, the higher that is, the less skin impedance we're going to have. So the more comfortable it's going to be for our patients. The last little thing here on this slide is the fact that this Russian protocol, and we'll see this with NMES as well, really targets more of the type 2 fast twitch muscle fibers. So these are the ones that are going to produce power, okay? They're going to fatigue much quicker, but they're the ones that produce power. The type 1 muscle fibers are kind of like our, those are like muscle fibers that are going to resist fatigue better. So like our postural muscles and those types of things. So when we're using something like Russian protocol or NMES, it's really commonplace to have the patient contract their muscle, like a voluntary contraction, while the unit is actually on and stimulating that muscle. So when that e-stim, when that electrical current kicks on, you're going to get some involuntary contraction, really targeting these type 2 muscle fibers. And then you're going to ask your patient to contract with that. And that's going to, their voluntary contraction is going to stimulate the type 1 fibers. So we want this nice coordination of type 1 and type 2 muscle fibers. So it's really, again, important that you have them perform a voluntary contraction along with the contraction that they're experiencing with the actual e-stim unit. Okay, so on this slide we see more of a visual representation of the waveform and the characteristics for Russian protocol. So if we just look at this slide really quickly, the x-axis, the horizontal line there represents time. The y-axis, the vertical line, represents the current amplitude. And you can see that this waveform oscillates between a positive polarity, so that positive phase, and a negative polarity, or that negative phase. Again, this indicates an alternating current. We see that the carrier frequency is 2500 hertz, just referring to that underlying alternating current frequency. This again helps to reduce skin impedance and allows for that deeper muscle penetration with less discomfort. And we can also see that that carrier frequency of 2500 hertz is divided into bursts, which each last 10 milliseconds. Okay? These bursts allow for intermittent stimulation, which enhances muscle contraction efficiency and reduces fatigue. So the modulation makes the current feel more tolerable compared to something like a continuous waveform. So some of the clinical relevance here, obviously we are trying to maximize a muscle contraction, but we're also trying to help maintain that patient comfort. So we're going to use Russian protocol after surgery to help with muscle strengthening, so of the quadriceps following a, let's say, ACL reconstruction or a total knee replacement. We can use it for neuromuscular reeducation, so retraining muscles after a stroke or a nerve injury. And we're also going to use this to help prevent muscle atrophy in immobilized patients. Okay, so let's look at some of these Russian protocol parameters here. So the first thing we're going to look at is the amplitude. And just remember that the amplitude refers to the intensity of the electrical stimulation. This should be set high enough to produce a strong but a tolerable muscle contraction. The goal here is to maximize muscle fiber recruitment without causing any excessive discomfort. So we're going to increase that amplitude until a visible and a palpable muscle contraction occurs. Okay, we need to see that muscle contraction here. Then we look at the pulse duration. So unlike pulse current, where pulse duration is adjustable, Russian stimulation has a fixed pulse duration. The pulse duration is predetermined by the burst modulated AC waveform. And the key takeaway here is, again, you're not going to really have to adjust this. It's just part of that Russian stimulation protocol. Then we get to the on-off ratio. So the typical on-off ratio that we're going to use here is a 1:5 ratio, or 10 seconds on and 50 seconds off. So we're going to see 10 seconds of a contraction where we have active stimulation of the muscle, and they're going to be, again, performing a voluntary contraction with that as well. And then it's going to be followed by 50 seconds of rest, where the muscle is allowed to recover before the next contraction. This long rest period prevents muscle fatigue while still delivering effective stimulation. And then the last thing we're going to look at here is the ramp time. So 2 to 5 seconds is typical while using these Russian stimulation protocols. Basically, the ramp time just controls how gradually the current increases and decreases at the beginning and the end of the contraction. So this just ensures that there's a smoother muscle contraction, reducing discomfort, and it prevents sudden jolts that could startle the patient or cause muscle spasms. Okay, so these are some of the protocols that we're going to be looking at in the lab setting whenever we start actually using and applying Russian protocol. Okay, so now let's look at neuromuscular electrical stimulation, or NMES. So why would we use something like NMES? Well, the same purpose as we would use Russian protocol, for strengthening muscles and to help with neuromuscular reeducation. Okay, so we can use this for weakened muscles due to injury, surgery, or any type of neurological condition. And it's going to be especially useful for your patients with conditions like stroke, spinal cord injuries, or post-surgical muscle atrophy. Instead of that nice alternating current, that sinusoidal wave that we saw with Russian, now we're going to see more of a biphasic current. So basically, again, meaning that current flows in both directions, positive and negative. That's similar to what we saw with the Russian stimulation, but it's a different waveform. Okay. Remember that this is going to be a little bit of a sharper incline and decline in the amplitude and that intensity. But regardless, because we're moving between that positive and negative, we have a balanced charge delivery, so this prevents skin irritation. So we're not trying to create a charge in the tissues here with this one. The other cool thing about NMES is that we can directly stimulate peripheral motor nerves. So NMES can bypass the central nervous system and directly stimulate those motor nerves, meaning that even if a patient has impaired voluntary muscle activation, NMES can artificially induce muscle contractions. So this is going to help our patients who struggle with this, what we call this voluntary muscle activation due to conditions like CVA or stroke, nerve injuries, prolonged immobilizations, and again, it can be used for atrophy prevention in post-surgical or immobilized patients. Just like we talked about with Russian stimulation, this type of wave current and waveform does stimulate these type 2 muscle fibers. So again, we're thinking that powerful, quick contraction from these type 2 muscle fibers, as opposed to a type 1, which is mainly used for endurance type activities. So again, if the patient can contract that muscle voluntarily, we want them to do that while the actual unit is stimulating their muscles. Okay, well, let's look at this slide now that outlines the key parameters for setting up NMES. So let's look at this pulse frequency first. So we see we have a range from 20 to 80 hertz, or pulses per second. So the frequency determines the type of muscle contraction produced. At lower frequencies, anywhere from about 20 to 40 hertz, these are going to produce kind of individual muscle twitches, almost like what we saw when we were looking at low rate 10s, where we set the frequency at 1 to 10. We could really see those individual muscle twitches compared to what we see with higher frequencies, around 50 to 80. This is meant to induce a sustained tetanic contraction, which are required for muscle strengthening. So we're going to play around with this in the lab setting so you can really feel the difference between those two. But typically when we're thinking of like some type of clinical application, 20 to 40 hertz for that frequency is usually used for neuro-re-ed or reducing muscle spasms. 50 to 80 is used for muscle strengthening because it induces that stronger, more sustained contraction. Then we get to the pulse duration. So we see our range here from 125 to 350 microseconds. Basically, the pulse duration refers to how long each pulse lasts. So shorter pulse durations, 125 to 200 microseconds, is usually more comfortable, but primarily activates the smaller muscles, and we'll talk about smaller and larger muscles here in a second. The longer pulse durations, anywhere from 200 to 350, is required for larger muscle groups, like the quadriceps, the hamstrings, the glutes, all of those different muscles. So something like a small muscle group may refer to the wrist extensors or facial muscles. So depending on the size of the muscle, we're going to either increase that pulse duration because it's a larger muscle, or decrease it because it's a smaller muscle. And then we get to the amplitude. So the intensity should be set to produce a visible, strong contraction. So patients should feel a strong but tolerable contraction of their muscles, and they should be trying to, again, voluntarily contract the muscle that you're targeting while it's on that on cycle. Higher intensity means that you're going to get greater recruitment of type 2 muscle fibers, which is good for muscle strengthening. So we want to start with maybe a lower intensity, gradually increase until a strong contraction is achieved, and we want to really avoid excessive intensity or amplitude that causes patient discomfort or patient guarding. Now let's look at the on-off ratio. We have a few different settings here that we can utilize. So let's talk about some of these first. So the 1 to 5 ratio, 10 seconds on, 50 seconds off, is used for weak muscles or early rehab stages. So again, remember that long rest period allows the muscle to kind of recuperate and fatigue less. There's a less likelihood that muscle is going to fatigue. So again, allows for full recovery before that next contraction really cycles through. A 1 to 3 ratio, or 10 seconds on, 30 seconds off, is used when muscle endurance improves. So whenever you start to notice that your patient is tolerating this Russian stimulation, NMES, then you can start to move to an on-off ratio of 1 to 3. So we're basically trying to improve the endurance of that muscle. And then we see a 1 to 2 ratio, 10 seconds on, 20 seconds off. This is used for more advanced strengthening. So this equals less recovery time for that muscle, produces more fatigue, but is really beneficial for trained individuals. So if somebody's really high level, maybe a 1 to 2 ratio would be appropriate for that person. And then let's look at the ramp time, still 2 to 5 seconds. Everything that we had mentioned beforehand. We're just trying to make this comfortable for us. We're trying to gradually increase, decrease that current while using this ramp time. Okay, so now let's we're still staying on the topic of strengthening and those kind of things, but we're going to look at biofeedback, which is a little bit different. So we kind of mentioned this before in our previous lectures, but let's actually kind of talk about biofeedback here in a little bit more detail. So what is biofeedback? Biofeedback is a technique that helps patients gain control over their muscle activity by providing some type of real-time feedback. So unlike NMES or Russian stimulation, which actively stimulates the muscle, biofeedback does not send electrical currents into the muscle. Instead, it detects the electrical signals generated by muscle contractions. So the goal here is to improve muscle control, enhance activation, or reduce excessive muscle tension. So we're going to slap on some surface electrodes that are very similar to what we call EMG electrodes to detect electrical activity of the muscles. The data is displayed on a screen by sound or maybe a visual cue to provide real-time feedback to the patient. So some of the units that we have for our lab will have a visual feedback and an audio feedback. And basically this helps train the patient to either increase or decrease muscle activation based on their needs. So we can help improve control and activation of specific muscles. So maybe somebody has some weakness, patient presents with muscle weakness or neuromuscular defects or deficiencies. We can help them regain voluntary control over their muscle functions. It's very often used in stroke rehabilitation to retrain weak muscles, helping a patient gain control over, let's say, the tib anterior to help reduce foot drop. And it can also be beneficial for orthopedic rehabilitation, such as retraining quadriceps activation post-ACL reconstruction. Another thing that we can use biofeedback for is to reduce tension in overactive or spastic muscles. So this helps patients with spasticity, muscle tightness, or excessive co-contraction of certain muscle groups, commonly used for neurological conditions like cerebral palsy or post-stroke spasticity. So, an example that I could think of is just trying to teach relaxation techniques to reduce upper trapezius overactivity in patients with chronic neck pain. So we can either use it to reduce tension in muscles or to try to strengthen voluntary control of those muscles for strength purposes. And again, remember that you're going to get some real-time feedback. So immediate feedback, allowing the patients to see how well they are contracting or relaxing their muscles. This definitely helps with motor learning by allowing patients to self-correct in real time. Okay, so now let's look at some of the biofeedback parameters. So these can be a little confusing, so I'm going to try to do my best to break these down in a way that is understandable for you all here. So let's look at the amplitude first. So basically this measures muscle electrical activity in microvolts. So like in the past, we talked about amplitude as we're increasing the intensity to try to get a muscle contraction or something along those lines. But the amplitude here refers to the amount of electrical activity generated by a muscle contraction, which is measured in microvolts. So the stronger the contraction, the higher the amplitude reading. So this helps to quantify muscle activation and track progress, and is used to assess baseline activity before any training begins. So we're looking at essentially how much activity the muscle is able to produce. We're not trying to stimulate the muscle with any type of intensity or for the amplitude setting here. Then let's go to the threshold. So what is the threshold? Basically, it's the minimum level of muscle activity required to trigger feedback. Okay, so It's a preset level of muscle activity that the patient must reach or stay below to receive visual or auditory feedback. And it's typically set based on the patient's needs. So example, for muscle strengthening, the patient must reach a higher threshold to encourage stronger contractions. Or for relaxation training, the patient must stay below a set threshold to reduce excessive tension or spasticity. So a patient recovering from stroke may have a threshold set to encourage activation of weak wrist extensors, or a patient with chronic upper trapezius tension may have a threshold set to reduce excessive muscle activation. And then we go to the gain. Sorry, I kind of moved on from that slide here. I wish I could go back to it. But let's talk about the gain really quick too. So the gain adjusts for sensitivity of the biofeedback device. So basically referring to the sensitivity of the biofeedback system in detecting any type of electrical activity. Adjusting gain changes how easily essentially the system picks up the muscle activity. So we can use a low gain from 1 to 10 microvolts, used basically essentially when the muscle is weak or difficult to activate. So an example would be a post-stroke patient with minimal voluntary activation. They may need a low gain setting to detect even small amounts of muscle activity. Or we can use a high gain, so 100 to 1,000 microvolts. This one is going to be used for stronger contractions or larger muscle groups. So an example here would be when an athlete retraining the quadriceps muscles after ACL surgery, they would need a higher gain setting to measure larger muscle activity accurately. So the reason that the gain is important is because if the gain is too high, the system may not pick up weak contractions, or if the gain is too low, the system may pick up too much background noise, making it harder for patients to see progress. And that brings us to the end of our strengthening neuromuscular re-education section for electrical stimulation. Really focus on Russian stimulation and NMES and those parameters. If you have any questions, please feel free to reach out to me. Hopefully we can start getting into the lab and using some of the biofeedback machines that we do currently have. So that way maybe those parameters would make a little bit more sense for you, because I know that can be a little confusing. However, like I said, let me know if you have any questions related to this section of e-stim, and thank you so much for stopping by. I'll see you in the next video.